I'm a lecturer from the Department of Consultative Dentistry, Faculty of Dentistry, University of Syah Kuala in Banda Aceh, Indonesia. Right now, I'm at the Oral and Dental Hospital, University of Syah Kuala, or Rumah Sakit Gigi dan Mulut Universitas Syah Kuala, which is located also in Banda Aceh. I'm here to demonstrate you how to set rubber dam isolation, single tooth isolation for endodontic procedures on tooth 4-6. Before that, I will need to introduce you the equipment of the set of rubber dam. The first one is rubber dam sheet. It comes in several colors and different thickness. The second is clamp. It has numerous shapes and sizes according to the shape and size of the tooth where the clamp is put. The third is punch. It functions to make hole on the sheet, and also the punch has several sizes of holes. The fourth is forceps. It functions to carry the clamp and place it on the tooth. And lastly, we have frame, which is used to finally set the rubber dam in overall. In addition, we will also need some other additional equipment such as template, which draws the location of each tooth at both maxillary and mandibular jaws. Dental floss. Dental floss has 4 functions. First, to tie the clamp. Second, to flush down the rubber dam at the interdental areas. The third, to help inverting the dam at certain individual tooth. And fourth, to help secure the dam at the other isolation end. Wedget. The function of wedget is to help secure the dam at the other isolation end. Okay, let's get started. We are going to use a phantom for this demonstration. Alright, we need to do some preparation before we set the rubber dam. We need to do thorough prophylaxis of the oral cavity, i.e. plaque, debris, and calculus. Check all this area. There shouldn't be any plaque, debris, and calculus. The tooth surface must be clean and dry. The second is to check the contact point in between teeth. We will need a dental floss to check the contact point. Check the contact point of the area where the rubber dam is going to be set. In this case, in the quadrant 4 or around tooth 4-7 until 4-4. Check the contact point in between 4-7 and 4-8, in between 4-7 and 4-6, in between 4-6 and 4-5, and in between 4-5 and 4-4. The contact point should not be too tight. Also check for any rough contact areas. If present, that area must be smoothened. And then anesthetize the gingiva if required. If patient feels pain when the clamp is placed, then anesthesia is then required. In this situation, we are going to place the clamp on tooth 4-6. So check the gum at the cervical area of this tooth. This area must be achieved. Whenever there is a gingival inflammation or swelling where the gingiva covers the cervical area, then preparatory treatment such as cutting of the gum, i.e. gingivectomy, must be performed first. Lastly, rinse and dry the operating field. As what I have mentioned before, the tooth surface must be clean and dry. Choose an appropriate clamp. Look, we have several different types of clamp here. We have the butterfly one and other types of clamp. Then we choose the one that is appropriate for tooth 4-6. In here, this one. This is the clamp that is suitable for tooth 4-6. Okay, after we have chosen the appropriate clamp, this is the suitable one. Then we need to put dental floss here. Put the dental floss at the buccal hole of the clamp. And then we take the forceps. We place the clamp on the tooth 4-6. After that, we check the fitness of the clamp here by moving the clamp like this. The clamp must be tight and there must be 4-point contacts. 1, 2, 3, 4. Whenever the fitness is good, then we can use this clamp for this tooth. After suitable clamp has been placed here on tooth 4-6, and then get the sheet, and then take the template. Here, we are going to make a hole on tooth 4-6. It's somewhere around here. Four six is somewhere around here. And after that, take the punch and then choose the hole, that size of hole that we're going to make. We are going to make a hole for tooth molar. Then we get the hole. For the sheet itself, we can stretch it a little bit like this to loosen the tightness. After that, bring the sheet inside the mouth here and place it onto the clamp over the bowl, which has been set on the tooth. Also, get through the holes over the teeth need to be exposed. Be careful, so that you need to do it very carefully so that the sheet is not torn. Okay, we have half part of the tooth to be exposed. Then we need to use a plastic instrument here to adjust at the other part. Okay, this area should not be exposed. This area should be covered by the sheet. So we need to adjust the clamp. We need to adjust the position of the clamp. Something like that. Okay, now we have the sheet here. We need to have the interdental areas, both at the mesial and distal. We have got the sheet to be flushed down at the interdental areas at both mesial and distal sides. Then it's done. Then we take the frame. With the frame, we tighten the sheet all over here and there. somewhere like this. We try to make it, to place it at the center. We adjust somewhere around here. After that, you need to check all over and at the other area. For example, there shouldn't be any leakage. Check here and here inside here also, there shouldn't be any leakage. And the other thing is that the sheet shouldn't be too tight. See, you can press here. At last, this is the final set of rubber dam isolation for endodontic treatment on tooth 4-6.